Hello, everybody. This is Linda here from Eklund Academy, eklundacademy.com. Check us out, and I am your favorite nursing instructor. Well, today we have a very interesting topic that we are going to talk about. We are going to talk about bullying in the workplace. That's right, you've heard it, bullying, also known as lateral violence. Yes, lateral violence, right? Bullying. It happens all the time. Today, you're going to know, you're going to recognize it. So if you are the bully, stay tuned. If you're not the bully and you're being bullied, stay tuned. So let's get this show started. All right, I'm going to start with telling a story because that is how I like to start my talks, right? So I was working on a certain ICU unit and I needed to call a certain physician. I picked up the phone and I said, "Hello, Dr. So and so. I'd like to call you because there has been a change in condition regarding your patient." Before I could even before I could even continue the conversation, the doctor completely flipped. Okay? This physician completely flipped and started to call me names, right? So, being the nurse that I am and how I handle situations, because I've been through this, right? It's not new. I decided to keep my cool. And all there was silence. And you know what I said? I said, "Thank you very much, doctor. Goodbye." Click, and I hung up the phone. Well, you could understand my blood was just boiling, and I really wanted to do something, right? I wanted to get back. But you know what? I said, I'm going to handle this like a professional. So at that facility, we had a service that was online that you could get on and that you could actually report and write up these physicians. So physicians that were bullying or getting out of hand, or maybe there was a physician that does something wrong, you can get on this service online and you can write them all up, right? Because remember, in the United States, most of these hospitals, these physicians have their own governing bodies, right? They have their own peer groups that handle such situations. Well, let me tell you what happened. Within 24 hours, I mean, when I came back to work the next day, I received a call. Ring, ring. I answered and I said, "Hello, this is Linda. I see you. How can I help you?" Mhm. And it was Dr. So and so. And Dr. So and so said, "Hi, Linda. How are you? Listen, I just wanted to apologize about the way that I behaved yesterday. And the things that I said, I don't know why I said those things. And I just want you to know that I'm sorry and it won't happen again." Just like that. And guess what I did? I said, "Doctor, it's all right. It's fine. I understand. Thank you so much for calling me and apologizing. I appreciate that. We can move on." And that was it. And you know what? After that, we saw each other and we were able to work with each other with no issues. Do you know why? Because from the moment that the issue started, I nipped it in the bud. Nipped it in the bud right away. This is a skill that I have not always used. This is something that I have not always understood. So let me tell you, when I first was a new grad, okay, and mind you, now, you have to listen to this. This is, well, I won't say too much about the area or the location, but I was a new grad and I was starting on a brand new unit. This unit had a bunch of older nurses, more experienced nurses. But do you know what they did when they saw a new grad, fresh breed like myself, coming onto their unit? There was no embracing. There was no, "Let me take you under my wing and show you and teach you and show you the way." It was, "You sink or swim." It was, I'm going to get you. It was every little thing that you do, I'm going to point it out. That is how it was. And at the time, I didn't know how to deal with that situation. And now I do, and I'm going to tell you guys how to do it. So, what do? If you come into a situation where you are being bullied, this is something that you need to take very, very seriously. Gone are the days when bullying was okay. Gone are the days when we knew and thought it was okay to say phrases like nurses eat their young. It is no longer acceptable. And so when you come into a situation like this, I will tell you right now, you need to check it. You need to check it. So the first thing that you need to do is confront. Confrontation is your best weapon. For example, if someone says something, hey, Linda, and says something bad, right? And you get upset about it. The worst thing you can do to yourself is keep that inside. Don't do it to yourself. You need to confront. Confrontation. You need to look at that person. You need to look them in the eye. You need to stand up if you have to. If you're sitting, you need to stand. You need to look them in the eye. You need to lean forward and you need to say it assertively that, hey, this is what you said, and I do not appreciate what you said. I was highly offended by what you said. Please do not say that or do that again. The next thing that you need to do, this is very important. It's called documentation. Documentation, right? Documentation. You need to document it and you need to put it in an email, okay? And send it not to your manager this time, send it to your charge nurse and say, hey, this is so and so. Today, this situation happened, and I had to speak to this individual and tell her this. I just want to let you know. That's all. That's it. Document these types of incidents. Now, some people may not agree with my method, but let me tell you, this method works, and I will tell you why later on. So you've already documented this. You've already confronted the individual. You've already laid it down, right? Most of the times, bullies are relentless, right? So you may think that this is done with, but they have a different plan. So they may continue to try to make your life miserable in your department or on your unit. This is when you need to use your brain, right? Not your emotions, but use your brain. And so what do? You need to now go to your charge nurse and say, hey, I'd like you to go with me as I talk to this individual. I'd like an intervention about this situation. And I want you as a witness so you can hear everything that I'm going to say. She will not say no. She will not say no. She will go with you. You will pull that nurse aside or whoever it is, and you will tell that person, hey, you did this again. And on that day, you did this again. I even emailed the charge nurse about this, and you continue to treat me in this manner. I am asking you to stop because it is making me uncomfortable, right? Okay, you have this conversation. Awesome. So now you have involved your charge nurse, and this nurse knows now that you are, like they like to say, not playing around. You're not going to tolerate her behavior. So what do? Documentation. This time you write an email. This time you CC your charge nurse. This time you CC your nurse manager. Hey, and you explain on such and such a day this occurred. and I confronted this nurse, and this happened. Well, she did again. And this time, I asked the charge nurse to go with me to speak to this individual. And you just say, I just want to inform you because I do not wish for this situation to continue. That's it. That's it. Okay. So your nurse manager will receive this. And depending on the type of management, right? The type of a manager that she is and how she manages, she will react differently. Okay. She may be the type of manager that says, "Psh, I don't care about that. Throw it out the window. But you've documented it. Or she may be the type of nurse manager to actually take this seriously and bring that individual in and talk to that individual. And then it will be nipped in the bud. You see, I wanted to tell you that if you do not nip it in the bud, what will happen is that one individual that has this disdain for you will now go and approach other nurses on the unit, and she will pull them in. Pull them in, because you've got to understand, bullies do not often act alone. They have this way, they're almost like magnets of just attracting people to their side. She will then gather people on her side, and you will find that you're getting these bullies all of a sudden, these looks all of a sudden, like you're getting these smart comments all of a sudden, and you won't understand where they're coming from. Well, right? They started with a certain individual that had a certain disdain for you, that you probably caught it, right? And you didn't check it. And so now they approach other individuals, and you find that the whole unit hates you. The whole Guys, I've seen it all the time. It's what we call gang. Okay, I can't say it on YouTube, right? I've seen it all the time. Okay. There's a special word for it, gang something, right? So you have to nip it in the bud. So then what do you do? If you've followed all of those steps and you've approached your manager and this continues, okay, you have to now start thinking about priorities in your life. Is this job number one? Does this job mean everything to you? Can you stay on this job and be bullied continually and work in such an aggressive and hostile environment? Or do you want to attempt to fix things? Because leaving it there when this continues will make things worse. I tell you what to do. Your next step now is to approach HR. Yes, the dreaded HR. Some of you are already saying, oh no, human resources. Yes, you have human resources as your backup plan. And if you work for a union, you've got your union representatives as your backup plan. Like, you are not by yourself. Do you guys understand that? You have all these people that are in your corner to help you. Use them. So if you have a union rep, go to your union and address that situation. If you don't, go straight to human resources. Guys, you have to do that. If you want to continue in that job and be happy, you have to do that. But if you're saying, well, I don't have to be happy, I just want a job, I just want a paycheck, I don't mind it, then go ahead and deal with it. Go ahead and deal with it. Okay? But understand that bullying, letter of violence, unchecked, can lead to a lot of mental problems. It can lead to depression, okay? It can lead to anxiety in the workplace. And as a result of you being depressed and anxious all the time, right? It can lead to you feeling isolated from your teammates. And as a result of all of that, okay? You will now begin to make errors on the unit. You will make mistakes. You will make mistakes. So it's not going to help you to be in that type of environment that doesn't want to see you grow. And I will tell you something that the best nursing instructor told me when I was in nursing school. She said, Linda, sometimes you will go and work, you will get a job in a place where they will not accept you, where you will not be a good fit. And she said, when you find yourself in that situation, you need to move on. Don't stick around, move on. For every nursing job that there is, there's 1,000 of them. You are in great demand. Do you understand that? You are in great demand. You can go work anywhere. You can go work anywhere in the world. Why on earth would you stay in a job that is abusing you? If human resources cannot stop it, if the managers on the unit cannot stop it, right? Then it's time for you to go. It's time for you to say goodbye and break ties, because that is not a healthy environment for you. Not at all. I have heard it so many times. Nurses that are depressed, nurses that are burnt out, nurses that are being bullied all the time. I've had to counsel nurses regarding this and encourage them. But guess what happened? When they finally made the decision to move on, find another job in another place, they called me. Linda, you will not believe how my life is. I am happy. I am fulfilled. Leaving that place was the best decision that I ever made. Leave, leave, leave. Okay? You will find your happy place in nursing. Nursing is so big, so great, so many hospitals, so many clinics, so many areas to work. Don't stay and be abused. Don't do it, right? And so now, what about the bully? Some of you are the bully. Yes, I am looking at you. Some of you, yes, you may be the bully. And you need to acknowledge that. Acknowledge your behavior, right? It's not okay for you to have a disdain for a nurse and you don't even understand why you have that disdain for that nurse. It is not okay for you to sit in the break room and gossip about another nurse. It is not okay for you to downplay a nurse's skills after she has gone through school, taken NCLEX like you, applied for the job and 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 hired for the same job that you are taking. It is not okay for you to be the bully. And let me tell you what you as a bully are doing. You are destroying the nursing field. You are part of the problem that is causing poor nursing retention, because these nurses that are ill treated end up quitting their jobs. I am saying this as a nurse who has gotten her master's degree. This is part of what we learn about nursing retention, some of the reasons why. Bullying is actually a major reason why nurses quit their job, especially new nurses within the first 6 months, and you're contributing to that. When you keep having nurses that quit and come, quit and go, that affects the flow of nursing on that unit. It affects patient care. And you should not be proud of your behavior. You should check yourself and try to change your behavior, because this nursing profession is for all of us. And if you continue in your behavior, you are damaging what we love. What we love. Don't take pride in it. if you are an individual that has mental issues, depression, anxiety, and you find that when you go to work, you unintentionally are taking these things out on nurses, stop, okay? I beg you, get some help. Go and get help. You know, you can go and get help. This is very important. Go and get help if you need to do that. But stop, okay? That's all I'm going to say as far as the bully goes. But guys, bullying comes in many forms. It can be a look, it can be verbal, nonverbal, it can be something somebody says as a joke that's not funny, right? It can be, you know, a smirk on their face. It can even come in the form of, well, you didn't know that? You didn't know that? They didn't teach you that in nursing school? Yeah, 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 yeah. It can come on so many levels, but it is one thing. It is bullying. Bullying, 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 bullying. And so, nurses, I hope you have enjoyed this and I hope it has been informative for you. And I hope that you are going to take some of the tips that I have given you today. And, you know, if this is something that you are struggling with, if this is something that is serious, you know, Eggland Academy is always there for you. These are certain issues that we deal with, and these are issues that we coach you on. Okay, so you know everything is below. All of my contact information. You can shoot me a question, ask me any question that you would like. Also, a copy of my ebook if, of course, you subscribe to my channel. You have to subscribe to my YouTube channel, and then you will get your free ebook. Okay, so go ahead and subscribe. And then every Sunday, when I do my reviews of who's a new subscriber, I send out these ebooks to everyone. And this is an amazing ebook. You will love it. The details are below. Support this channel, press the like button, subscribe, guys. This is going to help get this message out because these are topics that we really need to talk about. These are important topics, and this one is a short video, but we will go in depth, okay, on another video where we talk about physician bullying, from upper management, right? We'll get into all of that, but I just wanted to drive these points ahead that it's not, no one should tolerate it, right? No one should tolerate bullying, and no one should be the bully anymore. That was the 1960s, the 1950s, and in fact, when I work on a unit, I let them know I'm not participating in that, okay? I don't eat my young. I don't believe in sink or swim, none of that. None of that. And they know me. I'm known for that. So guys, see you later. Bye.